Hello, everybody. I'm Malcolm Alexander, Chair of Health Watch Hackney. I just want to thank you all for attending. I think we've got the largest number of people at any of our meetings ever, I think. I think 90 people have registered, which is fantastic. So thank you, and thank you to Canaria for organising the meeting, and to Richard Bull, one of our speakers today, and also Catherine Pelley, who will be joining us later. Just a couple of words about Health Watch. We're very, very interested in your experiences of health and social care in Hackney. So please share things with us, because if things are wrong, we want to do everything possible to make sure that things are corrected. So we have a lot of influence in the health and social care system locally. And just lastly, keep in touch. And if you want to join our team of volunteers, you'll be very welcome. So I hope you really enjoy the meeting today and you find it very useful and valuable. Thank you so much.
Thank you very much, Malcolm. And again, thank you all for joining, and thank you to our guest speakers as well for your time and contribution. We will start with Richard Bull, the CCG Primary Care Group Director, because he will not be able to stay until the end of the meeting. But again, we will be taking any questions for him if you have, and we'll feed back to you afterwards. Richard?
Thank you, Canaria. Good afternoon, everybody. So as Canaria says, my name is Richard Bull. I'm the Programme Director for Primary Care at City and Hackney Clinical Commissioning Group, and I'm overseeing the local COVID vaccination programme, working alongside my clinical lead, Dr. Steph Coughlin, who's a GP at Lower Clapton Group Practice. I'm really going to focus on the local delivery of the national programme. I'm not really here to talk about the COVID vaccine itself. I have shared with Health Watch what I think is a very helpful list of frequently asked questions that people ask about all sorts of questions about the vaccine. And by all means, if you need information, answers to your questions, please look there. So I'm not proposing to cover off questions about the vaccine itself, although I'm very happy to take those if there are no other questions about the actual delivery of the programme. I think it's important to be very clear that we are working very much in line with the national programme here. This is a nationally led programme, and City and Hackney has relatively limited options or choices in terms of how it responds locally to the vaccination challenge. It is a huge challenge. It is incredibly important, but nonetheless, it is challenging thinking about how to vaccinate a huge number of people as quickly and as safely as possible, but within national confines and within the limitation of the vaccine available. The national programme, I think, has been designed very much around the nature of the first vaccine that was available, which is the Pfizer vaccine. It's a great vaccine, it's clinically safe, it's well tested, but it does come with limitations in terms of how local systems can deliver it. It is quite unstable, it can't be moved very many times. There's a limit on how far it can travel from place to place. And so once it's been delivered to the place where you're going to be vaccinating from, you only really have 3.5 days to use up all of that vaccine, and you can't move that vaccine on again once you've started. So there are real limitations. The vaccine comes in deliveries of 975 doses. So the people planning to deliver the vaccine need to make sure that they can get through 975 doses in 3.5 days, which is quite a challenge. And that is why there are a limited number of places where you can go and be vaccinated. Now, as I say, the national system and the local system was set up around the Pfizer vaccine. Since then, of course, we now have the AstraZeneca Oxford vaccine, and that can be moved around much more freely. However, the national programme is still wedded to the way it's been set up initially. So what that means for residents and patients of City and Hackney is you have a number of choices of where you can go to be vaccinated. The majority of people, we understand, are waiting to be contacted by their GP. The GPs are contacting patients in priority order. That priority is not down to local determination. That's been decided for us nationally by the Joint Committee for Vaccines and IMS. And locally in City and Hackney, we were told to start with frontline health and social care workers first, and people aged 80 and above. That's cohorts 1 and 2. And then we were told, then once you've done, once you've made a good inroad into cohorts 1 and 2, then you can drop down and start vaccinating people in cohort 3, which is people aged 75 to 79. And then once you made a good inroad into those, then you can drop down and start vaccinating people aged 70 to 74 and people on the shielding list, people who are clinically extremely vulnerable. And there's a national target, I'm sure you're aware of this. Boris Johnson has given a commitment that everybody who's in those first 4 cohorts, 1, 2, 3, 4, will be vaccinated by the middle of February the 14th, Valentine's Day. And the plan in City and Hackney, we have a plan to do that, and we are on track to deliver that plan. We are on track to vaccinate all those people aged, all the people I've talked about, people in groups 1, 2, 3, 4. There are many other partners involved in delivering this program. The Homerton Hospital, they have supplies of vaccine, and they are predominantly for health and social care staff. So the majority of staff are going up there for their vaccination. We've been doing some primary care staff in the primary care vaccination centres. We have 2 primary care vaccination centres in City and Hackney. The one that opened up the first is in Bocking Street, B-O-C-K-I-N-G, and that's very close to St. Joseph's Hospice. And the second vaccination centre is in John Scott, and that only opened yesterday. So that was very exciting that that opened. So that in effect doubles the number of people we can vaccinate in any 1 week. There are other options. People will have been written letters from the national NHS, as opposed to the local NHS, as opposed to your local GP surgery, inviting you to attend your nearest mass vaccination centre. These are centres that have been set up for us. They've not necessarily been in, the local NHS has not necessarily been involved. Our nearest centres are at Excel, the Excel Centre in Newham, and also IKEA/Westfield Shopping Centre, Stratford. There are others, and residents can also go to certain community pharmacies for their vaccination too. Details of where you can go, the places you're eligible to attend, are all on the national booking portal. But if you can't go on the portal, I think you can also call is it 119 for help. So just to recap on your options, the majority of people will be invited by primary care to go to either Bocking Street or John Scott. The advice is to wait to be contacted by primary care. I recognise that people are being written to nationally, of course, and that is causing some confusion. But the advice is to wait to be contacted by your GP practice and invited in. Don't contact your practice beforehand, because obviously that might well overwhelm practices. The only deviation from that advice is if you are aged 80 or above and you've not been contacted by your practice and you are not housebound, please do give your practice a ring to get yourself booked in. We've done over half of the people aged 80 plus so far in City and Hackney, and over a quarter, 28% of people aged 75 to 79. We only started vaccinating 6 weeks ago, so that's not bad going. And as I say, we are on track to deliver by the end, reach the target, cohorts 1 to 4, by the middle of February. We are following national instructions in terms of the timing of the second dose. This is a 2-dose vaccine. We're inviting people in currently for their first dose, and we've been told we can't give second doses until 12 weeks. The only deviation to that is that for people that were vaccinated at Ellesdale Street, which was our first vaccination centre, which we subsequently closed down or moved to Bocking Street because Ellesdale was too small, sorry. Slow in terms of throughput as well because of its size. We offered the people that were seen in Bocking Street their second dose. But we're not allowed to do that anymore. Everybody else has to wait 11, 12 weeks for their second dose. Right, I'm aware that I only have 12 minutes left before I need to go, and no doubt people will have lots of questions. So try and answer as many questions as I can before I have to go, but I will also endeavour to answer questions that Kanari sent to me afterwards.
Definitely. Thank you very much, Richard. We already received many questions on the chat box. Salim, just give me a second. Yes, we'll take some questions now. And we'll. Who's speaking?
Yeah, it's Patricia Charlesworth.
Hi, Patricia.
I have. I have how many questions are we allowed to ask?
Well, just one at the moment, because someone else might be asking the same question as you that you can think of. Right. So,
what about Richard? What about people, older people, and people with learning disabilities? Are you aware of how many people with learning disabilities and older people with a learning disability are getting the vaccination? Over to you.
Thank you, Patricia. So, to answer the question.
Sorry, Peter, did you want to add anything to what Patricia was asking? We can't hear you.
Yeah. It was just to say that there was something going on in the background as well. When Patricia was talking, there's something else going on in the background?
I think I've muted everyone, so no, okay. Did you have any question for Richard, Peter? No.
No.
Okay,
no.
All right.
Okay, well, thank you for your question, Patricia, and thank you, Peter, for your contribution there.
Can I ask a question when you finish?
We are able to.
Hold on. Go ahead, Richard.
Thank you.
Thanks, Patricia.
So everybody over the age of 70, or if you are a shielding patient, clinically extremely vulnerable, you are now eligible to be vaccinated locally. We will be looking at the number of people with learning disabilities that are vaccinated in those groups. We are waiting for further guidance from the national NHS on additional groups of patients, including people with a learning disability, on when they can be vaccinated. At the moment, clinically extremely vulnerable, that category only includes people with a diagnosis of Down syndrome, but we would really like to crack on and offer the vaccine to other people known to primary care who are on the local learning disability registers.
Thank you, Richard. Richard, can I please ask if anyone has any question? Can you raise your hand by using the reactions at the bottom of the screen? Salim, yes, I can see you raising your hand.
Yes. My GP surgery contacted me to have vaccination, which I said yes. It was towards the beginning of this year, but unfortunately they were unable to secure the.
Salim, we can't hear you. Okay.
Waiting for my next one for the position. I
Salim,
have unmuted one.
Yes,
it's not
Salim.
Can you hear? Can you
Salim,
hear now?
Yes. Can you start your question from the beginning, because it was breaking up?
I was contacted by the GP surgery to have vaccinated, which I said yes, but they were unable. Oh my God.
No, we can hear you, Salim.
But they were unable to secure. But they were unable to secure the vaccination for me in the Val Street, vaccination center. On the 16th of January, I went to Excel after receiving the letter and got vaccinated, the first one, and waiting for the second one. But my question on this one is that, number one, the ethnic minorities and especially those people who are vulnerable are not being contacted as much as you have rightly put it, that is a very sensitive product, could not be stored in everywhere. But why don't they have a larger number of booking so that those people who may not turn up or due to have missed someone, the vaccine is not being wasted? And how about the prioritizing those people who are genetically more prone to COVID-19 than the others one, even they may be in the same range of aging and disability?
Yes,
Right.
thank you.
As I've previously mentioned, the determination of the priorities for vaccination, who gets it first, that's not down to local decision. That's decided for us by the Joint Committee for Vaccinations and Immunisations. And it is they who've decided that those most at risk go first, and that is frontline health and social care workers and people aged 80 plus. And they've taken very much an age-based approach. The only exception to that is they've introduced people who are clinically extremely vulnerable as part of cohort 4, but they have decided on a largely age-based approach. We are opening up more appointments. It's a shame that you couldn't be seen locally. Demand goes up and down. In some places or at some particular times, some clinics, it's incredibly high. So keep trying. But as I say, we've opened up John Scott yesterday, and that's in double the number of people we're able to vaccinate each week. I hope that your experience of Excel was a positive one.
Okay, thank you. So there was one question regarding John Scott. My partner is 77 with COPD and will live 500 meters from John Scott. He's been invited to walking and he's extremely reluctant to take bus and overground to get there, given the safer proximity of going to John Scott. GP advised him to wait, but he doesn't want to miss it out. He doesn't want to miss out the opportunity. The invite to book came from here on practice itself. So contact them again, wait as advised, or what shall I do?
Sorry, Kanari, could you repeat that question?
Yes,
So I was
sure.
slightly distracted by somebody.
It's
So,
my question. Should I just
yes,
say it?
yeah, please go on.
So, this fellow right here got invited to go to Bocking Street, but we live only 500 meters from John Scott. I arranged a phone conversation with a GP at John Scott at Heron Practice. She said, rather than say, no, we're not interested in the text message that I got, to just wait, that John Scott would be open in a couple of weeks. This was last week when I spoke to her. Now that it is open, do we need to wait for another invite for him that says come to John Scott? Because I just looked on my phone and it's still last week's invite to go to Bocking. And he is nervous about getting on a bus and the overground because he just doesn't want to go that far and go on public transport right now.
Just give your practice a ring and they will book you into John Scott. There are appointments available today at John Scott, so you might even be able to be seen today.
Thank you. No, I just wanted to confirm that because of the advice to not call GPs and not inundate them. But thank you for saying that in this case, it is a good thing to do.
Very good, thank you. Any other questions, or I can ask some of the questions from the chat box? One other question, Richard, is, I am a carer. Will I be called up the same time as care partner and I'm allergic? Can I have it?
I
Did
think,
you hear that?
Yes, it depends on the age of the person you are cared for. We try to do eligible people with their carers at the same time. Clearly, that's the best thing to do. So it really does depend on the age of the person you're caring for, or whether they're clinically extremely vulnerable.
Okay.
So as soon as they're invited, if you make it known that you'd both like to be vaccinated at the same time, I'm sure that will be possible.
Okay, and I'll get one more question from the chat box. I understand the need to prioritize vulnerable people first. What about those in working age that might not necessarily have an underlying health conditions, but need to be out and about to work, those under 50s? What's the timing expected for these people?
The timing for those people is entirely dependent upon the supply of vaccine that comes through to this country, either the vaccine that this country makes or receives. At the moment, I'm completely in the dark. I'm not told what that supply of vaccine looks like. We just received deliveries in City and Hackney from the national government according to their own supply. It's not something we have any control over, and there's no knowing at this point in time when younger people will be vaccinated.
Thank you very much. Richard, I'm aware that you have to go now.
I had a question. I did put my hand up. My hand is up.
Sorry, Oleander. Okay, can we get one more question, Richard? And then we will accept all the questions on the chat box, if that's okay. I'm really sorry. Go on, Oleander.
Thank you, Richard. Just wanted to find out, for people who do, I was watching the news some time ago, and they said that there's a particular vaccine that is not good for people who have EpiPens. They should not take that particular vaccine. Is that still the case? And also, would my GP know that my son has severe nut allergies, and that particular vaccine, whatever it was, I can't remember, should not be given to him? And what will he be offered in Hackney? What are the vaccines that's been used here? Sorry, I know that's a lot, but
that is, I'll try and answer that. So I think that's the Pfizer vaccine, the one that people are told if you've had a severe reaction in the past, either unexplained or due to medicine, not to have the Pfizer vaccine. By all means, I think you should seek advice from your GP. I believe the AZ is safer. I think there are fewer severe reactions to the AZ, but by all means, speak to your GP. Pfizer and AZ, it will both be available locally.
Thank you. And don't forget that Catherine Pelley is about to speak as well. She might cover your questions, and I'm sure she will be able to answer your questions as well, as Richard has to go now. Yes, thank you very much, Richard. Sorry that you were not able to ask your questions too, Richard, but we'll make sure you receive the answers.
Sorry,
thank you.
But good luck for the rest of the meeting. Thanks very much.
Thank you. Thank you very much, Richard, once again. Catherine Pelley is our next speaker. She is the Chief Nurse and Director of Governance at Health Watch Hackney. Catherine, can you hear us?
I can, yes. Can you hear me?
Hi. Yes, we can. Hi, hello, Catherine.
Hello.
I can't hear you on my screen, but I'm sure I will see you shortly. But please,
Okay.
would you like to? Oh, I can hear you now. I can see you now.
Good afternoon, everybody. Thank you for inviting me. So I'm Chief Nurse here at the Homerton Hospital, and we provide obviously the hospital services and the community services and the care home provision at Mary Seacole. So our role in this really exciting and important vaccine campaign is we are currently providing vaccines to the health and social care workforce of City and Hackney. So we started ourselves on the 5th of January. We were expecting initially to deliver the Pfizer vaccine, but we're told on New Year's Eve that we were getting the Oxford AstraZeneca vaccine, with an expectation that we would set up our programme to deliver only 4 days later. So we've managed to do that. And our current position is that we've vaccinated over 3,300 health and social care workers from the borough. There are an awful lot more to go, but that's a really good starting point for us. We are offering the vaccine from the hospital site. We've got an education centre at the back of the site. So if you know the hospital and you've come in the back entrance off Clifton Road, that's where the hub is. And we've also done some sessions at St Leonard's, and we'll continue to provide a session at St Leonard's. Because we've got the Oxford AstraZeneca vaccine, we've got some more flexibility. So Richard talked about using a dose it all up in 3.5 days. We don't have to do that. The vaccine, if stored properly in a fridge, and it's at ordinary temperatures, not very, very cold, we can keep that for a number of weeks and months. But once you've broken into the vaccine bottle, which has got 10 doses in it, you've got to use it in 6 hours. So we spend a lot of time coming towards the end of our day making sure we are not wasting vaccine, because that's really important to us, that we're not doing that. We've had a very small amount of wastage, but often because we've got to the point of drawing it up, and then for very understandable reasons somebody's decided they don't want the vaccine. So our focus at the moment for the middle of February is to try and make sure that health and social care workers in the borough get offered their vaccine. And if you are part of a organisation that is delivering health and social care, whether or not you're third sector or you're a statutory organisation, you should have been contacted, because we need your information so we can put you onto our booking system and make contact with you. If we've already contacted you and you've not booked in, please book in. If you want to turn up, we're offering sessions here this week till Saturday. On Thursday we'll be at St Leonard's, but the rest of the week we are here, and we can accommodate you as long as you bring your ID, because we need to prove that you are a health and social care worker. Because rather sadly, unfortunately, across most of the providers, we're getting people who don't meet the criteria currently for the vaccine, trying to get the vaccine. So we're having to be quite manage that quite well. So that's our current programme. We will give the first dose and we will give you your second dose as well. So when you book, you'll get an appointment for your second dose in between 10 to 12 weeks time. So the Oxford AstraZeneca vaccine is 2 doses with a 12-week gap. We're running about 10 to 12 weeks to make sure you get your appointment in 12 weeks. And we're also looking in the longer term about what our offer could be to the patient population, but that's more challenging for us, because we're not at the moment encouraging anybody, unless they're unwell, to come to the hospital site for quite obvious reasons. You may have read, we've been significantly overwhelmed by the pandemic in recent days and weeks, and that's why this programme is really, really important. This vaccine will make a difference. It will make a difference to the individuals who have it in terms of reducing their risk and of getting a severe illness as a result of the pandemic. But we also hope, we don't know this, but we also hope that if we get large percentages of our total population being vaccinated, that actually we will start to develop a way of reducing the transmission. What is also really, really important, the vaccine is not the only thing that we need to do. So we need to continue social distancing, hand hygiene, and following the lockdown rules. It has been particularly disappointing for us as a hospital that in recent days we've had 2 large events closed down by the police because people have chosen not to follow the lockdown rules. When we're trying to keep the hospital and manage the demand from a COVID perspective, has been particularly hard to take, really, if I'm honest. And we hope that those events don't lead to us having an upsurge in activity in 10 to 14 days time. So that's kind of where we are. Yeah, so I've got basically questions, really.
Thank you very much.
To answer some of them.
Thank you, Catherine. So we'll go with those who raised their hands first. Eva, I hope your question is still relevant for Catherine. Would you like to unmute yourself?
Yes, thank you.
Hello,
Catherine. Thank you so much to everybody so far that's provided a little bit more of an insight. I look after 2 elderly parents. I'm a carer at present, and they're aged 80-ish, 85. They were actually offered the first vaccine last year, and they were provided a cab to go to and from the venue, but we refused, we postponed rather, because we didn't have enough information. And our question that we posed to our GP at the time was, are my parents allergic medication? Is their medication allergic to any of the vaccine's components? And we weren't provided with that information. All we were told was that your parents are not allergic. It was very vague and very rushed at the time, so we didn't go ahead. Recently, we posed that question to the GP again, and we weren't provided with the information, but my mother and father decided to go along to the Boking Centre, which they were both vaccinated last week. I have to say, it was very well organised. However, it was very quick in the respect that they were in and out within 30 minutes. So it was literally registration. And then I took the leaflet over to the counter to register them whilst they were waiting to go in to be vaccinated. And then after obviously they were vaccinated, we waited 15 minutes just to ensure that there was no reaction. We were provided with a leaflet, Reg 174 information for UK recipients. We didn't have time to read this, where it says clearly that you need to read this prior to having the vaccine. So I wasn't very happy about this, but I didn't want to worry them because they're a little bit anxious to go in the first place. And it does say that obviously this medicine does not have a UK marketing authorization, but it has been given authorization for temporary supply. So there are a few little, areas that I'm a little bit concerned about, but obviously they've had the vaccine now, and they've been booked in for the beginning of April for their next one. It was just the uncertainty. I have to give credit to everybody that worked on Boking, because it was very well organised and very quick, but there was no time really to read the information provided. And, we have a right to actually read what we're being vaccinated with. So
I think just a couple of comments.
I've waffled on it.
Yeah, no, that's fine. But there's a couple of things. First of all, it's absolutely fantastic that your parents have had the vaccine. They are now more protected against this dreadful virus than they were. So that is absolutely fantastic. I appreciate your concerns about that, and they're valid concerns. But the most important thing is that they've been vaccinated and that they will get that protection. Now, I don't run the Boking Centre, so I can't comment about some of the detail of how quick they are, although we're moving people through quickly. If you have the Oxford AstraZeneca vaccine, which we offer, you don't have the 15-minute wait. And this is just because there are differences between the vaccine. And we do anticipate at some point in the UK getting the Moderna vaccine, which is currently in the United States, and that may have different rules. And that's part of our challenge. These aren't all exactly the same. But you are right to ask questions, and most of the information about allergies, if you had a severe allergic reaction to a vaccine previously, and I don't mean somebody just feeling a bit unwell or having a sore arm or a bit hot and bothered. This is somebody who's become very allergic, and you would know you've had an allergic reaction to a vaccine. So those people are being discouraged from having that until it's been agreed with the safest place. So last week, for example, here at the Homerton, we vaccinated an 86-year-old who needed to be on a hospital site to get the vaccine because she'd had a previous allergic reaction to a vaccine. We vaccinated her safely. She had no allergic reaction, and she's coming back for her second dose. So there are ways to manage some of that. So the first thing, if you have questions, there is a lot of information out there. Yes, you should be given the time. I think the problem is there is also an expectation that we will get through millions of people vaccinated as quickly as we possibly can. And often the only way to do that is to have a bit of a kind of production line of vaccines going through. That will settle as people get used to doing this and information. The fact that they've had it and had no allergic reaction is really, really positive. It is unlikely from the evidence that they would have an allergic reaction at their second one. If you're going to have an allergic reaction, it is more than likely that you will have it in the first few minutes of having the first dose.
Thank you, Catherine. Thank you. David Walter, would you like to ask your question? Sylvia, then I'll give the word to you.
Hello? Hello, can you hear me?
Yes, yes, we can, David.
Yeah, I'm concerned about the 12-week gap. I mean, if I get the first, I mean, when I get the first jab, do I get a certification for it, or do I have to have a complete, to complete the course to get the certification to say that I've been completely vaccinated? And why is it a 12-week and not a 4-week gap?
Okay.
Maybe how is the vaccination being registered? Is it registered somewhere?
So every single vaccine that is given is counted. So even in the primary care setting, so we are constantly telling the powers that be how many vaccines we've got and how many we've delivered, which is why Matt Hancock is able to confidently stand up every day and say 5.5 million people or whatever it is now. Your dose of vaccine will be reported on an IT system, and that links into your GP record. So the first dose, but when you are given your first dose, there is a little card, and I don't have one on my desk in front of me, which is a shame, which will, and you're often seeing people posting photographs of these if you're on any form of social media platform, which tells you which dose, which vaccine you've had, the batch number of that vaccine, the date of your vaccine, and your date of your second appointment. So you will have a little card record. But there is a process by which all the vaccines, even the vaccines that we're giving to staff, will drop into their GP record. So eventually there will be an electronic record of your vaccine as well. And I've had my vaccine, so I was the second person here at the hub to vaccinate. I vaccinated the first person here, but actually I've also checked, partly because I'm like that, with my GP, and they've got my record. They can tell me that what day I was vaccinated and what vaccine I had. So that system is working. But you will be given a card.
Thank you very much, Sylvia. Can I continue? Angela, you are next.
Why the 12 weeks?
Oh, sorry, I didn't respond to the 12 weeks. Sorry. The 12-week is so the testing of the vaccine went through a program to understand that we need 2 doses. Initially, those 2 doses, irrespective of the vaccine, was going to be given in a shorter period of time. What became clear when they started the vaccine was that there was a risk of a smaller number of the population being vaccinated. So we had I didn't. The JCVI, so the Joint Committee on Vaccinations and Immunisations, which are the people who decide where this vaccine goes, made a decision that actually it was safe to leave a gap between the 2 doses. And by doing that, because of the supply issues, and supply is still a challenge for us as a country, that actually you could give the first dose to more people. So basically you could either vaccinate 2.5 million people once, or 5 million people, 2.5 million people twice, or 5 million people once, and give some people a significant degree of protection. And the protection from the first dose is greater than lots of the vaccines that we already use routinely within our population. There is evidence building that actually the delay is going to be beneficial to your level of immunity. And certainly there's some early evidence coming out from around the world that is beneficial to us. But it was that kind of dose. So the gap is not going to cause you a problem. It just means that we don't have to. We can vaccinate more of the vulnerable population more quickly, which ultimately will get us out of the current situation that we're in and the lockdown arrangements that we're in.
Thank you. Thank you. Sylvia, would you like to go next?
Yes, I had my vaccine at University College Hospital yesterday. When I got back, I got the invitation through my GP. And the invitation is completely anonymous. You have to fill in your name, address, everything. So it's not specific to me. And I was wondering, the gentleman who was with his friend who was so nervous about traveling and wanted a choice of venue, I had that choice of venue. Since he's definitely eligible, could I pass my invitation on to him, which would save him bothering the GP and people who are so overworked?
Probably not, because he may not be, because there are different rules and eligibility for age and staff, it's probably not. But if he's had an invitation, he is eligible, so he should probably have a conversation with his GP about how he moves to a more local venue. So whilst we're discouraging people from just routinely contacting their GP and saying, when will I get a vaccine? If that gentleman has had a letter inviting him to Bocking but would like to go to John Scott, I'm sure that can be organised. What I can't tell you is whether or not they're offering different vaccines, because I'm not, as I said, I'm not running the primary care model, and I don't know what vaccine they've got off the top of my head.
Thank you, Catherine. Angela Phillips.
I'm rather interested in what Catherine said, because I was rather hoping that having two invitations from two different places wasn't possible in this system. It seems I'm very confused as to how decisions are being made about who is being called. I'm only 72, but I was also called by UCLH. I've had my vaccination. My husband, who's older than me, hasn't been called, although he's a UCLH patient as well. We haven't heard anything from John Scott. Hackney as a whole seems to be behind Camden and Islington in terms of getting the vaccinations moving, because I know a lot of people in Camden and Islington who are below 75 who've already been vaccinated. So I'm really think we need more clarity about how decisions are being made, who's making the decisions. Is UCLH making decisions on the basis of its own patients?
Yeah. So I can answer that. So the decision on who is currently getting the vaccine as groups of the population is made by the JCVI. So they've come up with a list of what they call the 9 cohorts, and we're currently focused on the cohorts 1 to 4.
That's just not what's happening, though.
No, can I finish? I need to start at the top. Sorry, let me finish, because it's important that we start at the beginning of this process. So they've set out the groups in the population that the mass vaccination sites, the GP practices and the hospital hubs must vaccinate. When this vaccination programme started in December, the only vaccine on offer was Pfizer. And there wasn't a massive supply, and there was significant restraints on who could take Pfizer and use it. So we couldn't, for example, at that point, for logistical reasons. So, but UCLH were one of the hospitals who were on day one started vaccinating. So they may well have got further through a patient group. The other aspect of this is London is split into different what we call SDP areas, and UCL is in a different one to City and Hackney. And there has been, although it's getting much more equalised, different distribution of vaccine based on demand, supply, and the ability of organisations to deliver it. Our supply is completely controlled regionally and nationally. So I only get told this morning how many vaccines I'm getting this week, and it's different to last week, and it's certainly different to the week before. So I think some of the difference is because we're not yet at the level of supply routinely coming out that meets all the cohorts. Now, if you're and of course the other issue is that the hospital hubs are contacting patients known to, so like UCLH, known to them, and GP practices are doing that as well. We're not running a patient program here at the Homerton because we can't currently, because we need to focus on the workforce. So each area is doing it slightly differently. So that might explain it. My suggestion would be for your husband, either go back to UCLH where you've had an experience, or contact your GP and try and get them into one or two of the local programs. But of course, remember that wherever you have your first vaccine is where you need to have your second vaccine. So you've got to be able to go back there for your second dose.
Okay.
Thanks, Catherine. Thank you. I hope Angela. Shirley, if you give me a second. Okay. Shirley, there are other people who are waiting to ask their questions, and I'll give the word to you if there is a time. All right. Okay. I can see a young person, Sasha Khan, who put their hand up.
I've had my hand
Hi,
up.
Sasha.
Yeah. Hi, thank you. I just have 2 quick questions. The first of which, I work for an organisation that supports older people in Hackney and Tower Hamlets. So we're getting quite a lot of phone calls at the moment of people who just want to have a chat about the vaccine, and I suppose just we're hearing kind of quite a lot of different concerns. The first kind of, I suppose, obstacle that I'm kind of finding a bit at the moment is people who have been contacted because they're ready to have their vaccine, but they don't have family who can help them travel. And I know that a couple of travel schemes for older people, such as Dial-A-Ride, actually aren't going to and from NHS appointments at the moment, probably to protect themselves. But the first question was, do you have, I suppose, any advice about supporting people who can travel to and from the vaccinations? I know that there's kind of going to be work to be done via GPs about people who are housebound. I suppose my question's more like people who are able to get out physically but maybe don't have the practical support. Another question was a slightly different one, but quite a common concern that I'm finding with people I'm speaking to is previously when people have had not necessarily allergic reactions to flu jabs, but more when they've had a flu jab and then have become quite unwell for a number of days or weeks afterwards. And I'm just noticing in phone calls that I'm having that it's making people quite anxious about having this vaccine. So I wondered if you just kind of had any general messaging advice for when that comes up. I'm trying to encourage people to have it, but I don't want to be kind of too coercive, I suppose.
Yeah. So there are transport schemes, and I think somebody's put something in the chat about to get people to vaccination centres. So that has been recognised because there's a number of reasons why people might not be able to independently access a vaccine centre, whether or not it's the primary care centres or the mass vaccination sites at Excel and Westfield. So there is that work. So allergic reaction, so side effects, feeling unwell after a vaccine is probably fairly common. And I've said this a lot. So for those who don't know me, I'm a health visitor by background. So I spent my career talking to parents of newborn babies about you having your dose, your child having a vaccine at 8 weeks. You probably need a bit of paracetamol or Calpol because they might feel a bit hot and bothered. I think first and foremost is that, you know, it is not unusual after you've had a vaccine to have a bit of a sore arm or to feel a little bit hot and bothered, or just not feel great. That doesn't necessarily mean there's a problem. That actually is probably an indication that your body's starting to work out that it needs to develop that immune response, which is what a vaccine does. You might not have any side effects equally, and some people aren't. So I think it's not unusual in any vaccine. So this isn't COVID vaccine specific. It's just sometimes how it is. So I can have the flu vaccine. I had the flu vaccine this year. I have it every year. This year, I didn't even know I'd had it. I mean, my arm wasn't even sore. But actually, in previous years, I've known my arm sore. I had the COVID vaccine, and probably what I would say is 24 hours later, I thought, oh gosh, I feel a bit, well, I was tired and I felt a bit kind of, I referred to this as I've been out for a party, but I'd not been to the party. So I just felt a little bit lousy. Went to bed early, took 2 paracetamol, woke up the next day and ultimately thought, well, actually, if that's the worst that happens to me, then, because actually, talk to somebody who's had COVID, talk to somebody who's been in intensive severe care with COVID, or one of our wards, and actually they'll tell you that's far worse. So I think expect to feel a little bit unwell, but it's definitely far better than the impact of this virus, because that is still, you know, people who are surviving this virus, even then would tell you how unwell they felt, particularly if they were hospitalised.
Thank you very much, Catherine. I'm aware that we don't have very much time to continue.
No, can I speak? Can I speak before you shut me off? Because you taken no notice. I'm Linda. Linda.
Oh, hi, Linda.
Right.
Yes.
I'm a person. I've got asthma. I've got allergies. I've had the flu jab, and it suffocated me and put me on a ventilator. It put me on a ventilator as well, so I never took another dosage of the flu jab. Would it be advisable for me to take the vaccination anyway? Because I don't go near anybody because the GP's left me to stay at home. I've got 2 kids at home with me, and I'm off the ventilator at the moment because I know I have to take the vaccination. Where am I supposed to go? Because I don't need to catch any infections from anybody.
Okay.
Linda, so you said you took Ventolin because after your flu vaccine, is that what you said? Or you said, oh, you were on a ventilator? Sorry.
I've had asthma where I'm going in and out of A&E.
Yeah.
I took the flu jab saying that would get the asthma down, reducing it, and it didn't. It made it worse. I had to go back on the Ventolin, and I ended up on penicillin as well.
Right. Okay. So I'm sorry that you weren't well after the flu vaccine. That probably was not the flu vaccine, to be honest, because the flu vaccine is not a live vaccine. It won't give you the flu. Rather sadly, it was probably just coincidence, which doesn't help you when you've probably felt so unwell. And
so why wouldn't it be the flu vaccine? I went to the GP for a flu vaccination, nothing else.
Sorry, say that again.
I went to my GP for a flu vaccination, and that's what they gave me.
No, so they gave you the flu vaccine, but that wouldn't necessarily have made your asthma worse.
It did.
Okay. I think it was probably coincidence, but that would be a conversation for you to have with your GP, who knows you far better than I do. The coronavirus, the COVID-19 vaccine is not a live vaccine. So you are not being given a dose of COVID. You are being given a vaccine that will allow your body to develop the antibodies to fight the vaccine and the virus should you get it. If you have severe allergies, then we would advise you to have a conversation with your GP about should you have the vaccine and how do you manage to do that safely, because they know your health far better than the vaccine centres. So that's the
I think A&E knows my health better than my GP, because I'm always in an A&E with asthma.
Okay, but when you go to A&E, your GP is told what we've done, how we've cared for you, and how we've treated you. So they will know that to be able to have that conversation with you. If you've not left the house and you are vulnerable, then the GPs are working with our community nursing services at the moment about how to access the vaccines to the housebound. So we are trying to support them to get to the housebound. So Linda, I would suggest have a conversation with your GP. But if the GP thinks that, and agrees with you that you should have the vaccine, I would absolutely encourage you to do that. Because actually, if you have got asthma, you are more at risk from COVID virus than you are from a reaction to the vaccine. But you need to talk to your GP.
Need to find a place to go where I'm not going where there's lots of people around.
But
to make
your GP can organise that. If they feel you want to have the vaccine, we are in the process of rolling out the offer to the housebound, so the GP can work through that with you. So
Linda, you can also
housebound.
You can also
Yeah.
get in touch with us so we can talk about it further, and let's see if we can provide any further information on this.
Okay,
yeah?
thank you.
No problem. Thank you. Catherine, would you be able to get a couple of more questions?
A few more questions, and then
okay.
I'm going to have to go.
Yes, all right. So I'll continue with Gilner and Kim, and then Gilner and Kim, and then I'm afraid we'll have to let Catherine go. Hi, Gilner.
Yeah, I was going to ask if a patient suffering with cancer and having treatment, maybe not in recently, but in the long run, they are having their treatment. Are they advised to have it, although they're in vulnerable group? But is it okay? Is it safe?
So somebody who's having cancer treatment and would be considered extremely clinically vulnerable. So they are in the cohorts to be offered the vaccine. Now, depending on where they are with their treatment specifically, they may be encouraged to delay it for a couple of weeks. So if you're having, if you were having chemotherapy today, you probably wouldn't want to have the COVID vaccine today either, if I'm honest. But that doesn't mean you can't have the vaccine. It just needs to be managed. And that's a conversation either with your GP or your consultant who's providing you with cancer treatment, because they understand all the issues about what medication you're on, whether or not you're immunocompromised, because you might be, and how best to do that. But we would be actively encouraging patients to have that conversation with their most appropriate healthcare professional, and then helping access the vaccine. But yeah, I think the starting point is yes, just to see if you can work out the safest and most appropriate way to have it.
Thank you. And Kim Byron?
Yeah, I'm here. I'm a bit confused as to the cohort that we belong to. My partner is considerably younger than me, but he has COPD, psoriasis, and a heart problem. And I am extremely allergic anyway, but I'm his carer, and I'm a carer for my 85-year-old father. And I'm not sure how all the information's tied up so that we get called up at the right time. Any advice?
So unfortunately, carers, so unpaid carers, I appreciate that, you know, you're still doing an absolutely essential job, aren't actually necessarily considered in this cohort, and that's a bit of an issue. But some practices are using their spare doses, or they're not wasting vaccine by giving it to family carers, unpaid carers. Your partner sounds as though they would be in the clinically vulnerable category, so they would be in one of the cohorts and they should be offered. But bearing in mind, practices are still working through from the 80s down to the 70s to the extremely clinically vulnerable. I think if your view is that, you know, their health needs would warrant them getting the vaccine and they would meet the criteria, then he probably needs to have a conversation with his GP about should he have it and when should he have it. Back to everybody, if you've got health issues, you do need to kind of understand that there's probably a benefit, and almost definitely a benefit to the vaccine, but it needs to be taken in the context of what else is happening at that moment in time for your health.
Okay, thank you very much.
Thank you very much, Catherine. And I'm aware many of you have other questions, and we received so many in the chat box, but I'm afraid we'll have to let Catherine go now. Thank you very much, Catherine, for joining, for providing all that useful information. Before you go, I think I'll need to ask this question really, because people are asking one question: how many people died from the vaccine? And they listed.
Nobody.
I just wanted to bring clarity around that.
But remember, close on 100,000 have died from the virus.
Yes.
Well, those are the people we must remember right now, and take the vaccine to not become one of those numbers. Is my that's why I've done it, and why I've encouraged my very elderly father to have it, and he has had it, because actually we can stop those numbers growing and growing.
Very good. Thank you. Thank you very much, Catherine, once again.
Thank you. Have a good day. Thank you for inviting me, and I will come back on the questions. Okay.
Thank you.
Take care. Bye-bye.
We are starting the poll again with the same question we had in the beginning. I'll appreciate if you take part in this now. And also, if you have any outstanding questions, please do send them to us in the chat box now, or I will be in touch with you after the meeting. You already have our email. Please do send them to us, but we'll put all the questions together, as I earlier said, with all the information that was shared today and answers to the questions that you asked. Then there was no time to respond, and we will share those with you in maximum couple of days. So keep an eye on your emails. Thank you so very much for joining. I really hope you found the information useful. But again, please do get in touch if you have any further questions. We'll wait another couple of minutes before for the poll. Let's see, Catherine. Oh, okay. Can we compare the results from now to the first?
Yes. So currently, 90% participants. 38 people say yes to the vaccine and 4 say no. So yes, pretty much the same as before, but hopefully people do feel better informed about what's happening in terms of vaccine delivery and other questions about the vaccine.
Excellent. Okay. Well, wish you have a good week. And again, please do get in touch if you have any questions, any concern and feedback you would like to share. Yes, have a good day. I'm ending the meeting now. It will stay open for you to put down your questions yet.
Yes, thank you for coming.
Thank you.
Hi, Karina. It's
Hi,
Patricia.
Patricia.
Thank you very much.
Thank you very much for joining.
Okay. You're welcome. I just wanted to say thank you very much for doing this. It's been very, very helpful. I've got
Same
my
here.
first vaccination. Yeah, I've got my first vaccination on Monday.
Oh, you had it already yesterday?
No, I'm having it next Monday.
Oh, okay, very good. Good.
Yeah.
And thanks for me as well.
Thank you. Thank you for your kind words, guys. Thank you. I appreciate it.
Can I just quickly ask, will you be able to send questions and answers?
Yes, this is what we will do.
Yeah.
We will
Yeah.
Yes, we'll make a list of all the questions asked and those that we received by email from members of the public, and we will share those with you with the
And
answers.
also, so I'm very sorry. And also, will you be displaying them on your website possibly?
We will. We'll share them on the website, on the social media.
Oh,
everywhere.
That's great. Amazing. Thank you
And
very
they
much.
will be all sent to you.
Thank you, Gunnar.
It was
Thank
lovely.
you.
Thank you.
Bye.
Bye-bye. Thanks for joining, guys. Thank you.
Thank
Jennifer,
you.
we can't hear you.
Yeah.
Thanks. Thanks. Bye, everybody. Have a good afternoon. Thank you.
Thank
that was
you.
very interesting.
You too. Thank you very much.
Thank you.
And keep
Bye,
an eye to
everybody.
join our next meetings as well.
Okay.
Yeah, we are holding information exchange meetings at the very last Tuesday of each month. And each month we have different topics. They're all very important and all health and care related. Very soon we will be sending information about our next meeting, which will happen on 23rd of February. Just confirming the topic now. But as soon as we have it set up, we will let you know. You can also join our newsletter to get this information before everyone else. Or you can join us on social media, or you can just drop us an email. Okay.
Well, thanks for the meeting. It was quite informative.
Thank you, David.
I was a little bit curious about the 12 weeks because probably obviously it's to do with supply issues and deciding which was better.
Yes.
Vaccinating more on a single dose or vaccinating fewer on a double dose.
Yes, and I saw